Medicare is confusing on purpose. 4 parts, dozens of plans, hundreds of commercials, and somehow you're expected to figure it all out on your own. Hi, I'm Ron Ray with Turning 65 Solutions, and today I'm going to break down Medicare Parts A, B, C, and D simply, clearly, and without the insurance jargon so that you can actually understand what you're signing up for. Today, we're going to cover Medicare Part C, also called Medicare Advantage. These are the plans that you see on TV and you get all the phone calls about. Now, we're going to do a real quick review since we're starting a new video. We've already covered Parts A, B, and D. Now, you have to remember that Part A is your hospital coverage. It covers your room and board in the hospital and hospital services. Part B is your medical coverage. It covers your outpatient services, anything outside the hospital, office visits, outpatient surgeries, anything that happens outside the hospital or even in the emergency room if you're not admitted to the hospital. That's all covered under Medicare Part B. Now, we talked about Medicare Part D. That's your drug coverage. So original Medicare, A and B, they don't cover drugs from the pharmacy. That's a separate program called Medicare Part D. And if you have original Medicare A and B, you're going to have a separate standalone prescription drug plan. Sometimes we call those PDPs. If you have Medicare Part C, which is what we're going to talk about today, that Part D coverage is usually built in. But let's just get right into Medicare Part C, also called Medicare Advantage. What this does is it takes A, B, and usually, but not always, D, and combines them into one convenient plan. Now, it usually includes Part D. Some plans don't, and those are built for a specific reason, but you have to be careful and watch out because if you have a plan that doesn't have Part D built into it, it's an HMO or a PPO or anything other than what's called a private fee-for-service plan, PFFS. You cannot have a standalone prescription drug plan. So I want you to be careful with that. It has to include the Part D coverage. It's called an MAPD, Medicare Advantage Prescription Drug Plan, all in one, or else you're going to have that late enrollment penalty that's going to start to accrue for Medicare Part D. I jumped ahead just a little bit, but let's just talk about what these are. They combine A, B, and sometimes D, and sometimes some extra benefits that Medicare doesn't cover. Now, most of these plans, but not all of them, and fewer as we get later into this season of changes with Medicare, things have been changing, costs are going up. This post-COVID era in Medicare has caused a lot of changes to Medicare Part C. A lot of them were free. It didn't cost you anything more than your Part B premium. So when you look at them, a lot of your HMOs and quite a few of the PPOs are going to be zero premium. Now, that doesn't mean you don't pay for them. It just means you don't pay anything above what you already pay for Medicare. Because remember, that $202.90 that you're paying for Medicare Part B, that doesn't go away. You're still going to pay that in most cases. But what happens is Medicare sends that money over to a private insurance company that you choose, and they combine your coverage and administer your health care for you. Now you play by their rules. Remember, these are the HMOs and the PPOs for the most part. There's also some called special needs plans and Medicare savings plans, private fee-for-service plans. We'll cover those in another video, but they're all lumped in under Medicare Part C, okay? So your monthly premium may very well be zero. Now, you still have to pay that Medicare Part B premium, which this year in 2026 is $202.90 for most people. Now, once you pay that, this is more of a pay-as-you-go type plan. So when you go to the doctor, that's where you'll pay when you have to use the services. Now, most of your primary care physician copays, you're going to have copays, right? It's copays, deductibles, coinsurance. Copays for primary physicians are going to be very low, if not zero. Most plans are going to be zero copay for your primary care doctor. But you go to a specialist and you're going to have copays there, and those copays are higher, $30, $40, $50, $60. They can get expensive if you go to 3 or 4 different specialists 2 or 3 times a year. Well, those costs can really start to add up. If you go to the hospital, you're going to have an out-of-pocket cost there. If you go to the emergency room or if you're admitted, it doesn't matter. You're going to have an out-of-pocket cost. If you have an outpatient surgery, or you need an MRI or a CAT scan or an X-ray or lab work or blood work or anything that's not covered under preventative, it's a diagnostic procedure. Preventative procedures are covered under the preventative benefits usually at no cost to you. But anything that's not a preventative, it's not coded as preventative, coded as diagnostic, you're going to pay out of pocket for all of those services. Now in 2026, the national maximum out-of-pocket limit set by Medicare is $8,850. Most plans are going to come in under that. In our area, we're at here in Central Texas, the HMOs are usually going to be around $3,000 or $4,000 of out-of-pocket maximum. PPOs around $6,000 or $7,000 out-of-pocket maximum. And what that means is, once all those little copays and deductibles and co-insurances that you've paid throughout the year, the calendar year, once that reaches that out-of-pocket maximum, you're done paying for the year. The plan takes over at 100% and you pay zero until January 1st, it starts all over again. Okay. So you got to watch out for that. The out-of-pocket maximum is an important number to look at. If you don't go to the doctor very often, you go once, twice a year just for your checkups, well, out-of-pocket maximum, maybe you can afford to have a plan with a higher out-of-pocket maximum. Or if you go often, well, you're going to want to look at a plan with a lower out-of-pocket maximum. Now, the other thing that these plans have, because they're HMOs and PPOs, it's called managed care. Another thing they have is a network of doctors. You have to go to their doctors. Now, HMOs are very strict. You can only go to their doctors. If you go to a doctor that's not on the list, well, you're just on your own. The insurance company isn't going to pay a penny. PPOs are more open. They'll let you go to the doctors that aren't on the list as long as the doctor agrees. But you just pay a little bit more. You pay that out-of-network cost, which can be quite a bit higher than the in-network cost. It's all designed to help save the insurance company money, which ideally is passed along to the consumers in the form of lower premiums, lower out-of-pocket costs, and more wider and deeper benefits packages. That's the idea. Now, they might also have additional benefits like vision, hearing, dental. They might have some over-the-counter allowances where they give you an account, like a little debit card, separate debit card, and every 3 months they might put $50 on it for you. Some of them might come with what they call a healthy food card, where maybe they put $100 a month on it for you to buy healthy food at the grocery store. You can't just buy anything. They have a list of foods that qualify for healthy foods. That's the extra benefits. One of the other things that comes along with the extra benefits and lower cost is managed care. We talked about the doctor networks. The other thing we need to talk about is prior authorization. So for anything that's not a life and death emergency or just an office visit, routine office visit, you have to get permission from the insurance company, and they can say no. That's another way that they try to control costs. So it's not you and your doctors making the decisions necessarily. It's the insurance companies. So if you're okay with that, a lot of times you don't even know there's a problem until it happens, because a lot of people do just fine on these plans. If you're okay with that, then it may not be a big deal. Another thing you need to watch out for is service areas. Now, they have service areas where you have to live and obtain your services. HMOs can be very small. They might only cover the county where you live. Now, PPOs might be bigger. They might cover the whole state or maybe even nationwide, as long as you can find a doctor who accepts the insurance. Again, if you're okay with all of those risks in exchange for that lower cost and more benefits, no problem. If you're the kind of person that wants predictability and freedom to go whatever doctor you want, you're going to want to stay on the original Medicare side with a Medicare supplement, a Medigap plan that we'll cover in the next video. But if you are more budget minded and like those expanded benefits, Medicare Part C, Medicare Advantage might be better for you. I hope that explains it. I've tried to keep it kind of short and simple and not get too complicated. But if you want to get into more detail about this and learn more about Medicare Part C or anything else that we do here, give us a call. The number's 830-217-6711, or look us up on the web at t65s.com. We've got a great website there with lots of free information. For most of it, you don't even have to put in your email address. But we look forward to seeing you on the next video. Remember, we've covered A, B, and D. This is now C. I'm going to link all of those other videos in the description down below so that you can find them. And if you've enjoyed this video, give us a thumbs up down below. That helps YouTube get this video out to other people who are seeking the same information that you were today. And don't forget to subscribe to the channel and click that little notification bell so that you can be notified when we upload the next helpful video. So until the next time, folks, we hope you have a great day. Bye.